Lynne, I suppose firstly if we can start, what were your own experiences? Did you suffer concussion when you were playing?
I did actually. Over the years, I played for 13 years and beyond that as well. And over the time, I would have got 2 head knocks and recovered fine and recovered very well from them. But naturally, just as the game became more professional, you understand more about how to prepare your body physically for the demands of the game, and you hope that that preparation obviously serves you well to be able to cope with the demands.
Did it leave you with worries? We heard Rugby Players Ireland saying they're contacted frequently by maybe retired players who are very concerned, even a little bit maybe paranoid about symptoms that they might be suffering.
Yeah, I think that's probably the value of this intervention, is that through good education we can understand how we kind of interpret those things. So I'm 10 years retired now, nearly 10 years retired, and shifted into a whole other stage in my life where I've got 3 small kids and a full-time fully employed mum as well, and life is busy. So if I'm forgetting things and forgetting times and things like that, it's how do I interpret that? Is that something I should worry about, or is that something that is just normal because life is busy? So I think the value of a screening like this is it raises awareness as to kind of give us an idea of where we are from a health screening point of view, and it obviously refers us to our healthcare professional to be able to manage the results of those tests according to what should be medically done. And what you'd hope is that lots of it will come out as normal, so the experiences of forgetting things or the experiences of how I process information is considered normal as opposed to worrying. But also if there's any abnormalities there, you're in the right pathway to be able to get further information and guidance.
And if you mentioned there's so many more layers to it for female players, isn't there?
Yeah, look, and I think both actually. Hearing Marcus and Devin talking there, I think there's an element in the men's game, as it's important to talk about these things and understand them and process them, and maybe there's more of an access from a female point of view to be able to talk about things. However, what females will probably more faced with, and I think parents should be faced with these demands as well, but like if I think back to having 3 kids and breastfeeding and trying to remember things and brain fog and all of those things, do I interpret them as anxiety in relation to brain health, or do I interpret them as just having a really busy life and juggling an awful lot of things, and hopefully having good guidance and good results from a screening tool like that will give some clarity.
How much chatter or worry would there be, say, in the group of women that you played with?
I think, do you know what, it's not that it's a constant topic. I think it comes with the territory, and I think with better understanding and good data and science and good screening tools like this and better information, I think that will just help settle people. And I think it's important. I think what's helpful is when you look across the game and you see the multi-pronged approach that World Rugby and other unions are doing at taking an approach to try and make sure the game is safe, with the tackle laws, with all of the different screening interventions and so on. I think that's a positive thing. We don't know what's going to happen in 5 or 10 years' time. I think we're in that era where we just have a couple of unknowns, but seeing the active effort that people are making to try and get answers to those things is helpful, and therefore I don't think it's an excessive amount of conversation that is in kind of my former players group about it, but it's something we're aware of.
Devin, I suppose, firstly, what were your own experiences with concussion? Did you suffer from it when you played?
I'm in the probably privileged position that I was actually not too bad with concussions. I don't think I ever had any diagnosed ones. I had one spark. I think we were playing away in Argentina in 2014 or 15, and I got a bit of a spark, but then I got taken off, and then nothing ever really was diagnosed. So I was kind of, as I say, I'm in a privileged position that I never really had any problems. So I never really had any concerns or anything. But I remember just chatting to someone yesterday. I think there's subconcussive stuff that can happen as well, just from the natural playing of rugby. So there might be a few concerns, I suppose, going down the line with that. But other than that, I'm as I said, I'm in a nice position.
What is the chat among, say, your former teammates and friends who played the game? Is there a lot of worry and concern about things that might happen down the line?
There's not really a lot of talk among people, to be honest, about worry. I think it's a very personal situation, and it's very private as well. Do you know what I mean? So like everyone's situation is different, and everyone has a different story to tell, and everyone has obviously a different injury profile around head knocks or any injuries, to be honest. So it's not really something that's talked about widely with everyone, I suppose. But I suppose there's learning as well. It is something that can be talked about and can be a talking point now, I suppose.
Yeah, do you think maybe men aren't as good? And Lynne was saying that amongst the female players, they maybe are a bit better at chatting about it.
Yeah, I wouldn't say they are really good at chatting. And again, I was saying I'm recently retired, I suppose, and I am gone. It's probably access as well to healthcare providers as well. Like when you're a professional player, if you've something wrong with you, you have a doctor there, you can go in and see him anytime you want, whereas now you're kind of out of the game, you don't see a doctor all that often, and like if I have a niggle going into work, I'm not going to go to the doctor to see it, you mean? So like it's having that access, I suppose, is great for past players.
Yeah, and would you be worried now? I suppose obviously there's been a lot in the media in recent years, and there's former players, as we know, taking cases against World Rugby. Does it make you think or sort of spark worries in you?
And again, it's all personal and it's all on an individual basis. And me personally, I've never really been concerned, as I said, because I've never really had any bad head knocks or bad concussions. So again, it's just a completely personal point of view. And if those individual players feel that that's needed, then that's needed, I suppose. But as I said, I'm in a privileged position that I haven't been concerned, which is great. We
heard Rugby Players Ireland just say there, they have been getting a lot of calls, and there is some concern amongst retired players, and even things like, if people are, forgetful about things, or they mislay things, they wonder, is this the start of something? Is it a sign? Have you heard stories like that?
I've heard a little bit of individual stories. I haven't heard any kind of specifics on who or anything like that, but like there are obviously those very worrying stories you hear as well from professional players all over the world. And again, as I said, it's all personal and it's all individual basis and stuff. So and again, it's not really something that's worried me, but I suppose you do hear those stories and you do get to think a little bit as well. Do you know what I mean? So again, this kind of service that has just been launched with Rugby Players Ireland and international rugby players, it just gives that extra little bit of peace of mind, I suppose. Because out of the game now, I did a baseline test, so I can go back in 2 years' time, 5 years' time, 10 years' time to see if there's been any bit of degradation or is there something that I need to work on, and it makes you think more about your brain health, I suppose, and that there is stuff you can do to keep your brain health active, I suppose. So
you've undergone the assessment already, have you?
Yeah, I did it last week. Yeah. It's tougher than it looks. You sit down for half an hour. There's 11 tests you have to do, all about your kind of your vocal fluency, your memory, your kind of loads of different tests anyway. And you're tired after, I suppose, for the amount of thinking you have to do. But again, it's a really nice baseline to have. To see how you fare in a couple of years' time. So
what would be your message now to say former players and your former teammates maybe to go and get this done?
Absolutely. I think everyone who has played men's, women's, provincials, sevens, Irish, any kind of professional player, this is available to them, and I would encourage anyone to do it. Like, I don't see what would be the reason not to do it. Do you know what I mean? The most important thing in your body is your brain, I suppose, and it's important to look after it.
Éanna, first, I suppose, outline to us, what is this service about?
So the Brain Health Service is a service for retired players, primarily those who would have concerns around their health, not just their mental health but their physical health as well. We know that there's a lot of publicity in the media, in really anywhere you turn, about risk factors for developing neurodegenerative disease later on in life, and whether or not having played in a contact sport is one of those. The problem being that there are limited resources for players to actually look into that and get some solid evidence-based information from it. So one of the positives of COVID was that back at that period of time, some of the large studies in the US started to move onto an online format, and we took that idea, and Dr. Martin Raftery and Deirdre Keating, who are heading up this program for us, took that process, and we brought 5 evidence-based, recognised tools and put them into one space, and they're available to a retired player cohort to go in and look at cognition, executive functioning, mood, sleep, exercise, and look at all of what are called the modifiable risk factors. So the Lancet publication in 2020 identified those areas in your health, your lifestyle health, that can affect your risk for developing things like dementia later on in life. And there are a lot of them are basic ones that you would understand, like exercise, sleep, but ones that are overlooked would be risk factors for untreated anxiety and depression, social isolation, untreated hearing loss. They're all ones that we can pick up and we can manage them. As simple as managing your blood pressure properly. They're all things that can be done in a primary care setting, but once identified can have a significant impact on the player's health later on in life. So the purpose, one, is to help reassure people who are concerned and need to understand, are there any risks to them? And then second of all, to identify those modifiable risk factors for them for later on in life.
So how is this going to work? Are they going to be offered an assessment?
Yeah, so the Rugby Players Ireland have contacted all of their members. So right now it's available to players who've played professionally or played interprovincial rugby. We hope to expand that in time, but as we're starting, we need to understand what the uptake will be like for that service. So they've been contacted, and there are two phases. First, they will contact the service, and they'll meet with a brain health practitioner who will basically walk them through. They'll fill out their demographic information early on and some questionnaires around health. And then the second phase is they'll go through the testing process, which is actually quite difficult. And having done it myself, it makes you it makes you sweat when you're doing the process. But the idea being that you get a thorough review of how you're functioning, and in that review, then not only if that's fine, you can go away and come back in a couple of years and have it rechecked again if you wish. If there are any issues identified, then we can move things on and have that investigated further.
You talk about the other modifiable risks, and obviously, the obvious lifestyle ones. Is World Rugby maybe trying to downplay or take the focus off the risks that are involved, as we know, though, with collision sports?
No, I suppose the point is when you're dealing with a retired player cohort, they have played the game at that point in time. Yeah, and from the point of view of any exposure they may or may not have had, that's in the past. So we're dealing with the parts that we can actually deal with right now. I can understand how someone might ask that question, but from the point of view of the player right in front of you right now, when you manage them when they're active, when you manage them when they're retired, you're going to deal with all of this process anyway. So dealing within the retired cohort, it's just that to date that hasn't been available to this cohort.
And are you seeing a lot of worry and concern among that group, the retired players?
It's interesting to hear Simon Keogh from Rugby Player Ireland talk about. He said they've been contacted quite a lot by their player cohort, and they were one of the first group to really grab this with two hands and say they wanted to be heavily involved. Because they had no availability on how they could help the group in that space. So I think in a reverse manner, I think it's always good to have dialogue in this space. It's much better to have people talking about it and have an open conversation about what people are concerned about, because at least then you can deal with what's to be dealt with. I'd much rather have us in a situation where we're having questions asked but we're able to give some answers than people sitting silently at home worried.
And what about those that they're playing now? Obviously, you're across that on a daily basis. Do you think the current protocols, the return to play protocols that we see, that are quoted in the media every week ahead of big games, do you think that they are enough? So
Rugby has been to the forefront in this space of all sports. We were the first sport to introduce an off-field assessment. Our process on what we call individualised rehabilitation. That's an approach taken which is based on the player's risk factors, the player's history, the player's presentation at the time. So we've used an evidence-based approach to tailor that outcome. There will always be cases where there are questions asked, and that's healthy part of the dialogue on this. What we can be reassured is that the people looking after these players are very well trained. We understand the level that they're trained. They're working in the player's best interest, and we just need to be sure that we have as uniform a process as we have. You're always going to have outliers which we monitor and keep an eye on, but I think all in all it's a space where we're continuing to learn. We will always work to improve it. We're doing well, but we can always do better.
Do you think at the time the players should have to sit out between, and we've seen recently, players who maybe have come off, failed the first step of the HIA, and they're back out playing in a very big game the following weekend? That makes a lot of people very uncomfortable.
Yeah, and when you're looking at that, the one thing I will say is that the people who are uncomfortable in that situation aren't aware of what the actual finer details of that assessment are. We know, I would argue that that's an indication that the process is working well. If that player doesn't go back on the pitch, on the day, that means there's a concern that there's an issue. I'd much rather that player not go back onto the pitch, but if they complete the rest of their process symptom-free, be in a position to play the following week, then what we would have had in the past, which was that player would have stayed on the pitch and perhaps been at risk of more injury in that situation.
Do you think rugby is a safe game now?
So rugby has risks. It's a contact sport. It's a sport that inherently, the risk is part of the enjoyment of the game. I think we talk about not just when we're playing, but the risk of winning or losing, the risk of winning a collision or losing a collision. These are all parts of what people actually want to play the sport. My job is to make sure that we do that as safely as we can. So I think none of these activities are risk-free. They never will be, and I don't think people want them to be. If you talk to the player group, they enjoy the physical nature of the game. Our job is to make that as safe as we can.